Hello, James here, and welcome to Podaholiks and a podcast replay. I have two sections for you from our homeopathy conversation with Dr. Ryan Penny. Dr. Jenna Burton and myself had a great conversation with Ryan about homeopathy. Go and listen to the whole thing. But I've pulled out these two particular sections because I was really intrigued by how well today are homeopaths and medical doctors actually working? Do they talk together? Do they refer to each other? Do they respect each other? You know, the basics. It was an interesting conversation because as much as we have developed and science has taken us to infinity and beyond in 2020, homeopathy and medicine still have a way to go. Well, at least that's my take on it. Give this a listen. It's Podaholiks and Dr. Ryan Penny, Dr. Jenna Burton, and myself talking about the relationship between homeopaths and doctors.
And then when I got to Dubai, I was really keen to try and get training together. So doctors that were working in clinics that were keen to learn, let's all come together and have sort of a bit of a lunch, maybe once a month, and share our knowledge. And it was totally shut down. Mm-hmm. And I think people found it unusual that I was quite keen to refer out when I felt, not even when it was something out of my specialty, if I felt they would be better suited to a different style of doctor, I had no problem with referring them. And that's just from the training that I've received. Whereas people be like, now you want to try and manage them yourself and keep everything to yourself. And it's like, that's not what's right for the patient. And ultimately that's what we're here to do. And so I found it quite challenging even just here. And people will often feel threatened by other doctors that come in. Whereas my mindset is that people will naturally gravitate towards the correct physician for them. And that's just nature.
100%. That is such a good observation, and that's something that we sort of have experienced as well. Sean, I think one of his strengths is he probably refers more than anybody I know. He honestly does. He will look at you and he'll say to you, listen, I can do this and that, absolutely no question, but that thing I'm not touching. You go to so-and-so. And it's that sort of mindset. So there isn't the collaboration necessarily, but there's the recognition that, as I said, there's the line I draw, whether that's a legal line that's been imposed, often unfairly so in my opinion, but that's what it is, or that really is outside of my scope and somebody else is going to do a better job than me. But it's because it comes down to what you mentioned, and that is, if you keep in view that the patient is the focal point, then you can have these discussions. If you go back and the issue is me and my reputation and how I'm seen, then the patient is a means to an end. And that's certainly not what we want to go ahead and do. And I think that's why Sean and I have sort of withdrawn in many respects in Dubai. I mean, we keep a pretty low profile. You know, we're not out there trying to do anything other than sit across the table from a person who needs help, and we're eager to want to give it. So it's refreshing to hear the sort of mindset that you have.
I think there are other people that feel the same way, though.
Well, what gets in the way of this more collaborative approach? I mean, it seems like we've gone so close to, you know, as you're talking about, the wave is there, the motivation is there. I know that there's a whole policy issue, and policies, I mean, you know, public policy is a huge conundrum globally because it does not keep up with what's going on. I think of my own country, Canada. Public policy is, 20, 30 years behind what's going on in any of the professions, medical through to communication, etc. Is that the challenge, or is it what's the block that is not just referring, but literally having the medical doctor, the homeopathic doctor in the same place, having the same conversation at the same time?
I think it depends on which region you're in. So in Dubai, I don't think there's any reason why that can't occur.
Sure.
And as Ryan sort of alluded to before, is a lot of it is on the individual perception and also on money. We're in a private healthcare system, so why...
Everyone needs to bill.
Well, that's it. And it's like I said just a moment ago about you want to try and keep hold of your patients. It's all about keeping hold of your patients. Whereas sometimes if you've got, and I mentioned it earlier, back pain, and I've given them I'm going up the pain chart and I'm feeling like they're now getting side effects, getting really bad constipation because we've got them on regular opioids, they're feeling a bit woozy, they're not quite right for surgery, and surgery is not a a quick fix, they will have other problems down the line. Maybe there's something else out there that could work for them, and would be much better to go to somebody like Ryan and Sean. And we've not mentioned you are the Wellness Brothers, so we should probably get that plug in there. But likewise, in a different healthcare system like the NHS, homeopathy is banned as a prescription, but yet it still occurs, and there's a big sort of NHS insight as to why is it still occurring. Probably because there are elements of it that work for general practitioners, but officially it's banned and you're not allowed to make the prescription.
Really?
Apart from the odd thing like acupuncture, which you'll now find acupuncturists in some GP surgeries. So that would be a regulatory border. And the problem,
because that's the policy issue right there.
So it's a cost. Again, it comes back to money, doesn't it? It's a cost implication. I think it's a lack of understanding. But the problem with doing something like that is also it stops and narrows the scope of GPs generally, because then they will think, well, if the regulatory bodies don't agree with it, then obviously there's something not quite right with it, or it's unsafe, and they don't necessarily go and ask the questions that maybe they should.
What I love about that part is, and again, I mean, you sum it up so well, but you look at that and you say, is it possibly unsafe? I love it when somebody says homeopathy is potentially unsafe, because they're acknowledging it must do something.
Just
So you can't have it both ways. Right. You can't choose it's a placebo and it's unsafe. Pick one. Yeah. I love that. Just love when people go that particular route, because it's like, again,
it legitimizes. It's suddenly got legitimation.
If you tell me that it's going to do something that you might not want it to do, then you have to acknowledge there's something there that's doing something.
Yeah.
Which is great. Now you need the skill to be able to identify when do I use it and how do I use it. Yeah. And that's where the training comes in. But I think one of the biggest problems with regards homeopathy is, again, the bulk of homeopathy that has sort of presented itself or made itself known is the classical homeopathy. And again, I'm not here to shoot down classical homeopathy. I've chosen a different path because I think that there is a better system of integration with good medical understanding, with an idea that, you know what, there are some complex homeopathics that have been studied. Maybe not to the same level as, is required by an FDA or those kinds of things. But the reality is there are some homeopathics, and there are some good double-blind placebo-controlled trials that indicate, this thing really works. So it validates the concept, and it then gives clarity for somebody like a GP who then doesn't necessarily have to have all the philosophy and all the understanding, but to say, you know what, Traumeal is a reasonably well-studied product, comes in a cream, comes in an injectable form and in a tablet. And if I've got somebody with a low back pain or somebody with, some sort of arthritic issue, and the study suggests that after 6 weeks, the efficacy is similar to the use of a non-steroidal anti-inflammatory without those potential risks, then that is something that should be considered. But again, as soon as you have policy, which ironically is usually put into place for people, as soon as policy rises above people, it's lost its reason for being there. And unfortunately, that's when you say there's something 20, 30 years behind. It's because they've usually lost focus of why did we do this in the first place?
Yeah, for sure. So when you guys would meet in the clinic, and you've got complimentary patients, is it getting more complimentary, the medicine, the homeopaths and the doctors, or is there still the medical doctors, or is there still that barrier, a little bit of misunderstanding?
From experience, I found that when I first started, it was definitely, they were in two camps. So doctors would maybe speak ill of homeopathic doctors and potentially... All right, it still exists in some places. And homeopathic doctors would speak ill of medical doctors.
You make it sound like you're like ancient.
No, but because
when
it
you
has
first started.
But true, James, it has. It's been quite a recent development. I think even if you just look at back pain, it's only been within my career that now acupuncture in the NHS has been allowed for back pain, and that is an alternative therapy. So it has been quite a recent thing, and I would now say if you meet a lot of doctors, they will have their medical spiel, but then they'll also have maybe this other little bracket of, you know what, I don't know enough about it, but it's not going to do you any harm. Why don't you go and give it a go? Because ultimately clinical medicine has run out for things such as back pain, a lot of anxiety, lots of other, there's lots of chronic fatigue, things like this, where we just don't have, it's not within our remit to be able to look after it, and we don't have a magic pill that does do the blocking or the more aggressive sort of intervention. And I think a lot of doctors are becoming more curious about it, definitely. And I think the whole mindset of medicine has changed generally. You think about a typical consultant years ago, and again, it is within my career time, within being a medical student, you would have a consultant who thought that they were, quite frankly, God. You weren't allowed, James, don't take photographs of me. I get really self-conscious. They thought that they weren't allowed to be challenged. Nurses were on the ward around to run errands and things like that. Fast forward to now, the consultant is one of a team player. The nurses are able to put their input into things, as are allied health professionals such as physiotherapists, dietitians, speech and language therapists. They're really well respected. And I think now that we've got that teamwork approach, I think the newer generation of doctors are more open to different ideas. And I think what Ryan's saying is that homeopathy is about supporting the body to heal itself. And there's this whole new generation of medicine that's looking at wellness generally. How can you do things yourself without taking a tablet that will allow you to remain in better physical condition? And one thing I think we should clarify whilst we're talking is when I met Ryan's brother, Sean, what astounded me is that they had done equal training to us. So I've done a 5-year degree, and then obviously you go on and do all your specialties and things like that. But equally, Ryan and Sean have done a 5-year degree in homeopathy. So this isn't like a day course of somebody that goes over to have a little look at these little vials and looks at some herbs. This is it's its own very unique standpoint from medicine.
So what, Ryan, what is the kind of training? Because we'll come back to this doctor. So the relationship between the homeopath and the medical doctor, but also within there, it's kind of the triangle, because you've got your patients, if we call them patients,
absolutely,
who also have gone through this whole process of growing up and visiting their pediatricians and then going through the whole course of medicine where their minds have been programmed a little bit. It's been reinforced. Well, this is why you go to a doctor. This is what a doctor does. And there could be some skepticism with homeopathy and other alternative medicines. So we'll come back to that. But so walk us through your background. How did you get into this field, and why?
Okay. Before I do that, I love what you just said there, and I just want to tie that together. All of medicine, no matter which way you look at it, is a belief system. That's what it comes down to. You said you sort of program the mind. Yeah. All of medicine is a belief system. You either believe in this, now you might have evidence for that, or you might not have evidence for that. So one of the things is very, very important to recognize it's the person as well. Jenna might be more open to that discussion than somebody else. So we'll come back to that. It's just as I say, each one of them is what do they hold to.